Welcome to the Pediatric Dietitian Podcast, where we, Jen and Danielle, discuss all things related to nutrition for children of all ages so that you, the parents, can learn practical, evidence-based solutions to nourish your child long-term.
Today we are going to talk about first foods for babies.
Sorry, we have a little different setup today, working remotely, but we'll probably be together next time. But yeah, bear with us today. As we're in two separate locations trying to make things work. But yeah, what are we talking about today?
Yeah, and so we're going to talk about from first foods to finger foods. So kind of like a brief overview of how to get your little one set up to start solids.
Yeah,
The
so
good
we'll
stuff.
go over the basic fundamentals, especially for new parents, right? So the foods that are potential allergen foods, we'll go over how to do like regular solid food versus pureed baby food, how to prevent picky eating. It starts now. It starts like start eating food and what not to do. As always, we have some fun stories of real life patients of ours that we will share. But yeah, let's get into it.
So yeah, there's like, I feel like there's so many like methods of starting baby foods, like baby-led weaning. I feel like maybe like 10 years ago, I came into
Yeah.
it started becoming more popular, and it's like definitely taken off, I think, over the last few years. It's definitely
It's become
a lot more popular.
Yeah, a lot more mainstream, right? And I think like
Yeah.
10 years ago it was like all, I don't know, even controversial, which is funny because in other countries it's the norm.
Yeah.
And they don't have a name for it, like baby-led weaning. They're just like, we feed our kid food. And so I think it's a positive, ultimately. I've seen a lot of positives from it in my experience with all of my patients, as far as how kids develop their oral skills and learning to chew and bite and eat a variety of textures. I've seen a lot of benefits in how that prevents and can reverse some picky eating and some oral aversions, like the kids who have already developed some aversions as a result of a few things like delaying starting solids or just having a lot of medical factors and a medical background like contributing to their oral aversions. But yeah, it's been quite beneficial. But yeah, I think it's super confusing because you still see like on Instagram these reels of like this, recipe for a pureed baby food that has like beets and thyme and feta. And I'm like, we don't need all of this actually.
Yeah.
And so parents will ask me like, do you have any good recipes for making my own baby food? I bought my own like baby food blender. And that's cool. I just don't think it's necessary at all.
Agreed.
You know?
I know they have like that blender that heats it up and like purees it all at the same time to make your own foods. And it's, yeah. I mean, you can take a banana and you can smash it, and that's the same thing. We don't have to reinvent the wheel.
Yeah. So, I mean, that's cool and all. I don't think there's much wrong with it unless you're only doing puree. So I do think only doing pureed baby food and for too long could land you in some trouble. So like I've seen kids like be on pureed baby food for too many months and now they gag with any solid food, like any real solid food with more texture. And then they spit it all out and the parents get freaked out. So then they think, well, now they can only have pureed baby food because they look what happens when I give them regular food.
Exactly. They gag. Yeah. I mean, they gag with everything. Like they gag with their hands, like the kid, like kids have like an intense gag reflex, you can't.
Yeah, they can
Stop them from eating anything.
So yeah, like I like to teach parents that gagging doesn't mean to stop. It's not a scary thing. You shouldn't let that deter you from continuing to feed your child or continuing to let them feed themselves, right? And so there's a difference between gagging and choking. And so choking, the kid is actually not making any sound. You can't hear anything coming out of their of their mouth. And so gagging, you can still hear sound. They're trying to get the food out of their mouth or out of the back of their mouth. And choking, it is actually lodged in their esophagus.
Mhm.
So with gagging, it can be a normal part of just learning to eat. And they only grow out of it if you let them continue to practice and
Mhm.
struggle through the gagging process.
Yeah, totally.
It's important that you don't react in like a nervous, scared way, I think, when kids are gagging, right?
Mhm. I know the more fear that you have, then they have the same fear and they're looking at you like, what the heck is going on? And, you
Right.
know, it is definitely the scariest thing like you could do as a parent to watch your kid kind of gag on something, but it also like you said, it like teaches them how to balance the food in their mouth, how to use their tongue, like how to make sure that they can cough up the food if they were to kind of choke on something. So it's definitely an important reflex for them to kind of develop, right?
Exactly. Yeah. So I do like to explain like if your baby is gagging on something or coughing on something, you should demonstrate how they should spit it out. So like put your
Yeah.
hand out in front of their mouth or in front of yours, stick your own tongue out and make the coughing sound. Like
Mhm.
you're kind of encouraging them to copy you. So do whatever you can first before you like shove your finger into their mouth and like take all the food out. That's kind of traumatizing.
Yeah. I've also heard it's more dangerous to put your finger in their mouth because you could also push it back further and
That makes sense.
lead to choking. So, yeah,
Yep.
I think you kind of just have to, or, you honestly have to show them how to chew too. Like, it's not, something that they just innately learn. So, like, mimicking the chewing motion is super helpful too. Yeah.
Absolutely. I mean, so a lot of learning to eat is modeling and copying, right?
Mhm.
So that's why when you're feeding your 6-month-old for the first time, or just in general, like when you're feeding your kids, you should be eating with them. So the concept of, or like a routine to not get into is I made my kid or my baby's food first and put it in front of them. And then I went and got my own food. So they're eating. By the time they're done is when I'm sitting down to eat.
Yeah.
So like that's a very bad habit to get into. I understand why it's happening to a lot of parents, but I really recommend that you just get all the food ready together at the beginning and
Mhm.
sit down together, because your 6-month-old does need to see you chewing
Mhm.
and you feeding yourself in order to learn to do the same eventually. So that's one
Exactly.
of the other things I see happen is parents are just sitting in front of their 6-month-old and spoon feeding them
Yeah.
and they're not eating themselves, right? And then the baby is not learning to feed themselves. They're just sitting there
Yeah.
like
Agreed. It's such
dead.
an old school thing. Like my mom, sorry, mom, like I'm gonna call her out, but it's like, it's such an old school way of like, here comes the airplane kind of thing. And she was so surprised when we would just give him a spoon and let him just kind of go at it. And she's
Your son, you
what are you
mean?
doing? Yeah, my son.
Yeah.
Sorry. Obviously he's gonna make a mess. He's barely gonna get most of it in his mouth, but he's learning. Like he's got to figure out how to lift the spoon, put it to his mouth. Like it's such a learning process that's so good for them to kind of develop on their own.
Yeah. So I do think it's nice to kind of do a combination of different methods of feeding in the beginning while babies are first learning. So number one, I do think it's important not to feed solids before like 5, 6 months of age. I know like the typical window is 4 to 6 months,
Hmm.
but there's a couple things you're looking for. First, they should be able to, as long as there's no severe medical problems, by the way, but first they should be able to hold themselves sitting up, like with minimal assistance. Like as long as they can sit up on their own with you, like just holding your hands around their hips or their butt, then they should be able to keep themselves up. Like their
Yeah.
trunk should be strong enough to keep themselves up, right? And then the other thing is they should look interested in food. Like when
Hmm.
they see mom or dad eating, they should look like, what is
Yeah.
that? I'm
Start to
super
like open their
curious.
mouth, lick their
Yeah.
lips.
And if when you go to give them a taste of something, they should be like ready and willing and wanting to try it. And if they're like,
Definitely.
then it's not time. And then like
Yeah.
wait a couple weeks and try again, right? So like those are the signs you're looking for. The main signs, those are what you're looking for. If there are like a lot of medical issues or medical conditions and your child may never be able to hold themselves up on their own, or it might just take a lot longer, then really work with your pediatrician and dietitian as far as when is the appropriate time to start solids, because waiting for those signs might not apply to your child. We're in this episode, we're mainly talking about kids who don't have medical issues that are causing like more physical delays or oral delays. But yeah, I like to do a combination of feeding pureed baby food that mom or dad is feeding them with a spoon. You could like have two spoons, one for the parent and one for the baby, to like, they want to kind of hold and participate. And yeah, they're going to fling it and make a mess, right? And then you can actually get some food in that they're actually going to swallow, but you can also have like some solids in there, right? So that they're getting a mix. They're not just swallowing purees. Like, yeah, we need some calories. We want to make sure they're actually swallowing stuff, but we can do like some hand held solids like the baby led weaning. And I like that because it could also be something they're holding. It could be something that's on the parents or siblings' plate. So they're feeling like part of the family. We're
Yeah.
all eating the same thing to a degree, right? So like if you guys are eating chicken and rice and broccoli, you could puree up something from that. And then you could also like save a piece of chicken or broccoli for them to like hold and practice bringing in and out of their own mouth. Because when they feel like they're in control, they're more excited about it. And then also, side note, rice is one of the hardest foods for babies to learn to
Yeah.
eat, by the way, because it's such a tiny piece of food that they
Much
have to
chewing involved.
control. Yep, there's a lot of chewing, but there's a lot of control involved. So it requires like lateralization of the tongue, like the tongue be able to move in the right ways. And like it can easily go in the back of their mouth and cause them to gag. It's just very hard to control. And it's not a food you can easily mash up
Yeah.
typically, unless you're like cooking it wrong. So yeah, it's funny because a lot of families I know start with something like rice and they're like, well, he didn't like it, he gagged. I'm like, yeah, that's one of the worst things to start
It's
with.
true. It's so tricky because little pieces get kind of stuck in your throat or your mouth, and you're just kind of like, how do I manage this?
Right.
It's not the best,
Exactly.
easiest first food.
So those little pieces that can be hard to maneuver and control can contribute more to gagging. And then the more a kid is gagging because you're feeding them the wrong food, the more negative they're associating. Like they're associating meals with negative experience because they're like, well,
Yeah.
every time you feed me, you give me these weird little foods and I gag. And
Yeah.
that's more appropriate for older babies, like 9, 10 months, where they can handle the smaller foods. They can handle the smaller foods usually when they can do their pincer grasp and they're just like picking up foods like this. Right.
Yeah.
But if they're
Pick
picking
one.
foods like this, you need bigger pieces of food.
Yeah. Honestly, like we started with like a long piece of steak. It was like my mom again thought I was insane, but it was just like, I didn't expect him to swallow any of it. Like none of it was gonna make it down to his stomach, which was totally fine. It was more about the process of like tasting it and trying a new flavor and like just gnawing on it like a teether. It's like not really meant, like even at 6 months, like this food, it really isn't meant for calories. They're getting calories from breast milk or formula. Like they don't need the calories from it as much. It's more to learn like tastes and textures and, different flavors. So, I'm sure we've talked about this before, but a couple of programs that we like Solid Starts is a really great one. They have an awesome app where you can literally type in any food. It shows you exactly how to cut it up for each age, which is really important. You want to make sure that you're slowly adjusting the cutting on the food as the kid gets older.
Like the
you're
size
obviously
of the
gonna,
food.
yeah, the sides. Like you're obviously in the beginning, you start with like a lamb, piece of steak, and then you can't continue that forever. Eventually, you start to kind of chop things up a little bit smaller so that you can actually consume it. But yeah, Solid Starts is great. 101 Before One is another one that's really awesome.
Solid Starts, they have a lot of free features in their app that we like to recommend parents to start looking at even before you start feeding solids, just so you can get ideas. But yeah, it's kind of counterintuitive, I would say, based on my experience with parents. Initially, parents think, well, it has to be tiny, tiny pieces of food because they're a tiny baby,
Yeah.
But in the beginning, the bigger, the safer. because they can't control tiny pieces of food yet. So if it's big enough, so it's bigger than their own hand, then it is safest so that they can pull it in and out of their own mouth. I'll tell you another thing that I hear commonly is, well, they don't have any teeth. So how are they going to
Exactly. You're like,
feed them pasta or scrambled eggs or ground beef? They don't have any teeth. But I'm like, yeah, I
those gums
know.
do the work. Those gums
Yeah.
are very powerful. You don't need to.
Yeah. Interestingly, I had a 1-year-old the other day who still didn't have any teeth. Apparently that can happen. There's just a wide range of when babies get teeth, but she was eating everything. Anything the parents fed her, she ate. She ate really well balanced meals, protein, starches, veggies, fruit, no teeth. And so the thing is, babies learn to chew and bite first without teeth, and then they get their teeth. So we cannot delay advancing in textures and to solids by just because they don't have teeth. We have to start challenging them early so that this actually prevents a lot of picky eating, is giving them a lot of textures to start with early. So one of the things we've seen happen, unfortunately, so this is something not to do, is to be on just pureed, smooth consistency baby foods for too long. So even if you do want to use a lot of pureed baby food, let's say your baby is like not gaining enough weight, and pediatricians like, let's start food so they get more high calorie things, and we can do like a lot of high calorie foods sometimes. And so they're like, but make sure it's pureed so that they actually swallow it. Yeah, we have to still consider long-term goals because we don't want a 10-month-old eventually still eating pureed baby food. And when we delay the introduction of other solid textures, it can cause aversions to those textures. And then it just is another problem you're going to have to deal with.
And you can still mix them in, like, you know, applesauce, like things like that have that, or mashed potatoes has that smooth texture, but we're mixing it in with something like, you know, the smaller bites of chicken as they get their pincher grasp and all those things. The other thing I was going to say is like, around 6 months, your iron needs go up, right? So you're supposed to introduce more iron-rich foods, but sometimes it is a little tough. Like I said, if you're having like a piece of steak that none of it is getting consumed, not a lot of iron is actually getting into their stomachs. That was kind of the time that I was using more of like a pureed meat or like a very soft beef stew or something like that to get those iron-rich foods in without feeling concerned that they're not going to get it in because they're not eating an entire chicken breast or something like that, you know? So there's other ways of getting like the nutrients in. And, you know, there's so many options for like pouches and the baby foods now that can be like incorporated with the baby-led weaning and with the good solids, but not be like the sole source of nutrition.
Yeah. You know, what's interesting is I feel like the go-to option that pediatricians or parents think that they should start their baby on, especially for iron, is iron fortified baby cereal. And it is an option. It's just like, that is not the only option, guys. Like, there is actually no reason that you can't start with a red meat for the iron, you know?
Totally. Yeah.
Yeah.
The cereal's great though, like in just an addition, like I would put formula or breast milk into the cereal to kind of fortify it. You can sneak peanut butter in there when you start introducing allergens, which we'll get to in a few minutes. You know, it doesn't have to be the only source of iron. It's also not a super high source of iron anyway. Like by the time they actually consume a portion of it, it's maybe 2 grams.
So yeah, I do really love introducing all the meats in the beginning, and in both pureed form so they actually swallow it, and then like the handheld solid piece of food form, like the strip of steak or like a chicken bone with a little bit of chicken still on it so they can suck a knot on it, is really great because of so many reasons. They're interactive with the meal. It's something the rest of the family is eating. They get to feel like we're in control. I'm feeding myself. That's more fun. And then you have like, while they take out that piece of steak from their mouth, it's like, here's a spoonful of the pureed meat. And then like with maybe I'm going to throw a vegetable in there too. So it's not just like pureed steak.
Yeah. basically something else. Yeah,
Yeah.
exactly.
But
But
yeah, so
that's why the baby-led weaning is so cool though, because it is like, they're part of the meal. And like I would make one meal for all of us. And so it doesn't feel like the kid is left out. We're just giving them, a sweet potato or something, and we're eating something more delicious on the side. It's kind of nice to all be included. And then you also don't have to make two different meals, which is ideal.
yeah, so people will ask me a lot, like, what do I think of certain things like Little Spoon
Hmm.
has like these subscriptions you can do, right, for baby foods
Yeah.
and such. I don't know. I feel like that can be helpful for some families, maybe who are traveling or they don't have time or whatever. And it's like, okay, that's better than nothing.
Hmm.
But
Yeah.
in general, the goal that you should be working towards is, well, the kid should be eating the same as us. So if I'm
Yeah.
ordering Little Spoon and using that every single day, it actually could contribute to picky eating as they get older,
Yeah. And
and
it's
not
essentially
great
like,
mealtime.
yeah, you're making them their own meal. You're eating something else. Yes, there are vegetables mixed in. Like it's nice products that have the vegetables kind of combined in, so that kind of sneaks it in there. But then it's also like you're not really a part of the meal if you're eating something totally different. I feel like that's also kind of a gateway to kids in the future having more picky eating, where they only want their chicken nuggets and you're going to eat the, roasted chicken on the sides, which is not ideal, but it's helpful, when you're in a pinch.
Certain seasons of life, I guess, like
Yeah.
just certain circumstances, but yeah,
Yeah.
for the routine, I don't think that's a good idea. But yeah, to your point of like chicken nuggets and stuff, that's another thing of like what not to do. Be careful. Think about this in the beginning months of feeding your baby and teaching your kid to eat solids. But like the whole concept of kid food is really like such a modern thing, and it's not real, you know? Kids learn to eat what they think is normal. And so
Mhm.
if they've just always eaten a certain way, if it's just always been this way, then they don't really think much of it. Again, we're
Yeah.
not talking about extreme circumstances. We're not talking about kids on the spectrum or with specific aversions and such. We're talking about kids who have no diagnosis and we're
Mhm.
just learning to eat. Okay. So,
Yeah.
like, if we only feed them chicken nuggets and french fries and, Dr. Prager's broccoli bites and whatever, that's what they'll learn to eat, and then when they're 6 and you're wondering why do they only want these foods, well, they were trained to be that way. And so the thing about packaged foods too is they're the same every time. They are the same shape, the same texture, they feel the same when you bite into it, there's no variability. And that's
Yeah.
the worst thing to give to a kid who's learning to eat for the first time. So they should be constantly challenged with learning different textures, different flavors. It looks different every time. It smells different because these are their months and years of exploration and learning and getting curious. And so we
Mhm.
shouldn't box them in and essentially make it easier. We make things easier when it's medically necessary, when kids are very underweight, when they're being diagnosed with something like failure to thrive, and we're trying to avoid like more medical interventions, then it's like do whatever it takes just to get them to eat. But when
Yeah.
you have a healthy baby that's 6, 7 months old and learning to eat, you should give them everything. Like,
Mhm.
don't hold back. You can flavor things. There can be garlic and things in their food. There can be cumin and cilantro and whatever. Like, it doesn't need to be plain. It doesn't
Mhm.
need to be like the same shape and presented the same way every time. That will cause them to learn, like, oh, well, now I want it this way every time. And so we
Mhm.
don't want, right? You want essentially your kids to be flexible and adaptable. And that only comes if you teach them that from the very
Yeah.
beginning.
I think they also sometimes surprise me. Like we made tacos the other night and maybe put a little bit too much spice in it. It was very spicy. My son took one bite. It was like, what is this? And then he went back for seconds and thirds and kept eating and he loved it. And he chugged milk the whole time, but I mean, I was surprised, but No, it's kind of cool to watch their like taste buds change too over time. Like he never would have ate that 6 months ago, but over time he started to get a little bit more adventurous, and it's cool to watch.
Exactly. That's such an important concept for parents to remember. Like what they may not have liked 6 months ago, 3 months
Yeah.
ago, doesn't mean they will continue not liking it. So don't like
Mhm.
cross something off the list forever.
Yeah.
Again, remember these beginning months and years early in their life is for exploration, curiosity, learning. So they're gonna constantly change their opinion. They'll like eggs this week and not next, right? And so that's even more prevalent in the early months and years of learning of life, really learning to eat. So yeah, don't hold back on flavors and spices and seasonings. I always tell this story of my niece when she was 10 months old. We were all out at a Mexican restaurant and she grabbed the salsa at the, they put the salsa on the table and then
Yeah.
the basket of chips. She grabbed the thing of salsa and like poured it in her mouth. And we were
I
like,
know.
like she got it before we could get to her, right? And she did the same as your son, like,
But
like kept eating it.
sometimes it's so good you can't stop.
But like for her, she loved the pain of spicy hot salsa, and for me, it's like nauseating when it's so hot, painful. But and she continues to eat like that today. Like she will just eat a raw clove of garlic. I'm like, I don't
Wow.
understand.
Come
But
through.
it's yeah, there's nothing like dangerous. There's nothing medically wrong. There's no reason from a nutrition or medical standpoint to stay away from spicy foods. I would say,
Mhm.
of course, like be cautious in the beginning. They might, especially for their first foods, you don't want that because you don't want them to, if they hate spiciness, which you don't know
Yeah.
until you try.
Associate that with every
Yeah,
food.
you don't want them to
Yeah.
associate that, like, oh, every time I eat, you like,
My mouth
ugh.
blows up. Like,
Yeah.
exactly.
So, but yeah, and you have to have something ready in case they don't like something spicy. You got to have something like milk or bread to like soak it up and help them,
Yeah.
right? But you got
Exactly.
to try all the things. So, a patient
Yeah.
story I have about that. So, I had two patients on the same day, and one is 7 months old, one's a year old. The year old one is who I just told you about. Like, she was eating everything. She doesn't even have any teeth. And the mom was not even worried. She's just like, oh, yeah, she eats like her chicken and her rice and her beans. She eats eggs and toast. A vegetable soup with chicken in it and tortillas. I'm like, awesome. She's like, there's nothing I put in front of her that she doesn't eat and everything the same as what the family eats. Like it's all
Mhm.
from the same pot or whatever. Okay, then I have this 7 month old and a completely different story. So he's only eating baby cereal and it 3 times a day, baby cereal, breakfast, lunch, dinner.
Mhm.
And because the mom tried like baby food, like the container baby food, sweet potatoes and carrots, and he just didn't seem to like it. He was like spitting it out and like really not
Yeah.
into eating it. And so she was like, well, he likes the baby cereal, so I'll just keep doing that. And I was like, okay, this is what we're gonna do. We're gonna do some handheld solid foods, bigger than his hand. It's something from the family meal. So if you guys made chicken, if you have an apple, if you have eggs, okay? We make them omelet style and then you cut it into like a strip so he can grab it and feed himself the egg, okay?
Mhm.
Anything, and you're gonna give him that. And then on the side, he's gonna have a pureed up thing from the
Yeah.
family meal as well. So like take the beans and rice and blend it up and take
Yeah.
the vegetable and blend it up. And you can spoon feed, but he's gonna have his piece of food that he's like chowing down on, and everything's gonna be seasoned how the family eats it. Like you're not gonna hold back the salt, you're not gonna hold back all the curry spices you like to put in everything. And she was like, okay, what?
Mhm.
Sure, I can do that. She was like, are you sure that's okay? Yeah. Oh, the next day, mom texted me and she was like, he loves the curry that I made.
Oh my gosh, so
Yeah.
cute. It's just so funny because it's such like a first time parent thing to be super scared, you know? And I think it's just like it's our fear. Your kid is fine. It's just like a parent fear. I think once you get over it, once you see that your kid actually enjoying food and trying new things, it's awesome. It's very cool to see. And I think it kind of helps get rid of that fear. You don't want to hold them back. You don't want them to be 2 years old still eating pouches and purees only. I always tell families, if you do have that fear when you are starting solids, like take a CPR class. Like if that helps you feel more empowered to let your kid try new foods, like, be mindful of what could happen and know that you could resolve the situation if you needed to. But, you can't let that fear hold your kid back from
Of course.
moving forward.
Absolutely. Yeah. So, yeah, I've unfortunately seen that fear holding parents back often. I've had many stories, unfortunately, of patients coming to me referred by the pediatrician for delayed feeding or underweight. And it's like a 10-month-old still on pureed baby foods only once or twice a day. And I'm like, well, you're feeding them like a 6-month-old baby, but they're 10 months. And it always comes down to the anxiety and the fear of the parent. And I'm like, you're holding your own child back. I'm sorry. I know this is
Yeah.
really uncomfortable and nerve-wracking, and you want your baby to be in a bubble and nothing bad to happen, but this is
Yeah.
life. And
What is
part
yeah.
of letting your child, like part of helping your child grow up is taking risks and
Mhm.
giving them the opportunity to be challenged and make mistakes. And it's an opportunity to get hurt in some way always, right? And like nothing challenging that helps you grow comes with no risk. And so that literally it still applies to feeding your child.
Yeah.
It's
Agreed.
just a necessary part of development. The Solid Starts website has like a choking first aid class, I believe, as well. That's very affordable.
We had a patient, I just thought about that when you were talking of that, was in the hospital like a year and a half, year old. It was mom's first baby. Unfortunately, he was stuck, kind of stuck in the hospital setting during that process, which kind of sucks. But um, she was terrified to give him solids, and even in a hospital setting with nurses and doctors around, she was still terrified. So honestly, they had the OTU that we have is so amazing. She would come by at lunchtime. She would sit with the mom and sit with the kid and just like be there as like a second set of eyes. And I think it gave the mom like so much relief knowing like just in case something does happen, I've got someone else here watching and we'll kind of get through. So like if you have a family member or someone that can come sit with you for meal times until you start getting like more comfortable with it, like anything will help because
Yeah.
it's like a scary process, but it's something
But
that
it's a
needs to
normal
get done.
process. It's a normal part of growing up, and everybody deals with
Exactly.
it, and everybody, so you're not alone in that. But yeah, anything to help your anxiety level go down because that can affect the baby for sure. Like even when
Mhm.
you're nursing or bottle feeding, right? So we've talked about that before. But like try to be chill. Your kid plays off
Yeah.
of you. You set the mood, right? So if you're freaking out when they start gagging on something, which is
Yeah.
not choking, then they will freak out. But if you stay calm, they'll stay calm. And so that is really important to set the tone there. Yeah, because nothing great comes from delaying solids. If
Yeah.
anything, it gets harder and harder because, for instance, the other day I had a 1 year old who, again, was delayed with starting solids, but now he has teeth. And so when we're going to start solids, like it just makes it harder because now he has teeth, but he's never been taught to chew or bite. And now he's probably going to, like, when we give him the strip of steak, he's going to bite something off, but he doesn't know how to chew it. And so he's just going to swallow it whole. And that's a huge choking hazard. And so
That's
I'm
even
like,
more
well, now,
scary too.
yeah,
Like
that's
if you're around, if the kid is like at school or something and a kid gives him
Mhm.
something that he has no idea how to chew, like that's
Yeah. So now he needs occupational therapy and feeding therapy because parents were too scared to start the solids at the appropriate age. And now he doesn't know how to chew. He just passively swallows because he's used to purees.
yeah.
So yeah, I just say start solids immediately. If we need to use purees, like because we want it to actually get in them, you can do that combination of both.
Yeah.
But yeah, the other thing that's old school and there's like no evidence for is one new food every 3 days. So bananas for 3 days, green beans for 3 days. Like,
Yeah.
we
That'd
don't
be
need
like
it,
the longest introduction to food. Like
right?
Like, takes,
Yeah.
like, 3 years to get through all, like,
Yeah, I don't even know how anyone's doing that today, but don't do that.
Yeah,
The only
not
thing to
needed.
really be paying attention to are the foods that are potential allergen risks. So we're talking peanuts, soy, shellfish, wheat, eggs, cow's milk. But keep in mind, if you're using a regular baby formula, there's cow's milk in there. And lactose is in breast milk. And then if the mom is breastfeeding and has dairy in their diet, they're already getting dairy. Okay. Tree nuts, sesame, and fish. These are these top potential allergen foods, right? So like we're hesitant. I mean, you need to be cautious when starting these foods if your baby already has some allergies. If your family already has allergies, like there's a history of food allergies, and if your baby has eczema, we need to be more cautious and paying attention. That does not mean we necessarily delay introducing these foods. Actually,
Yeah,
the
makes
evidence
it work.
now, again, like opposite of when we were born, but
Yeah.
right, the evidence now is like the earlier the better. Delaying introducing these foods can actually potentially cause more of a risk of developing food allergies. So,
Exactly.
yeah, we're supposed to start sooner rather than later. The first couple months of them learning to eat, they should be
Mhm,
being introduced to these foods. So, but don't introduce like peanuts and eggs on the same day because if there's a reaction, you want to know what it's from
mhm.
exactly. So I would make sure like that was the only new food that day was the high risk food, right?
Yeah.
So you can like really easily tell. But yeah, and then the sooner the better. And then like it's supposed to be in their diet like at least once a week, ideally 2 or 3 times a week.
Yeah, exactly. And I've also heard like you can start with a very small quantity and kind of increase the quantity and the dosage as you go up. If there are risk factors or you're kind of just being super careful. One thing that I did is we started with yogurt and then I added a little bit of peanut butter to that. A creamy nut butter is like honestly the easiest way to get nuts in. Try to get through as many of the common food allergies as you can. And
Yeah.
combining them,
Yeah. Cause they don't need to just eat a bite of cashew butter.
yeah,
It can be
exactly.
mixed into one of their foods. So like a way to get
Yeah.
sesame in an infant is with tahini. And that's
Mhm.
usually in hummus, and that's an
Yeah.
easy food. Okay, so we covered allergens. We covered a lot of things of what not to do. One more thing of what not to do is to use screens at meal times. Okay, so we've talked about that a lot with older kids, especially in the
Mhm.
context of like childhood obesity or kids that are already picky eaters. But again, we're thinking when you first start feeding your infant, how do I make sure I'm not going to create a picky eater, right? Like we
Yes.
can't
Yes.
completely prevent everything, right? But you can
Mhm.
do your best to set them up for success and making sure from the very beginning that they're not used to eating with a tablet, a phone,
Mhm.
a TV. That is optimal. So, as much as possible, you want to set them up for that success. Another part of that is eating at a table, eating at the regular table. I don't really like when the littles are eating at their toddler table over there, and then the big kids and the grown-ups are eating at the regular table.
Mhm.
I've talked to so many families that they're like, well, we live in a pretty small place and we actually don't have a table. And then we've talked about, okay, well, let's maneuver this and that and let's get a table, or we're going to like everybody sit at the counter or the island over there. Or it's like, well, the table is like covered in laundry all the time. Like,
Clean that.
I need to fix that.
Yeah,
Okay.
fix that first. But
Yeah.
it's such a good method of like learning about those family meal times and like developing that skill forever. You don't want your kid to be that kid that's just running around the house during dinner and not eating a thing. I think like if you start from the beginning of like, this is mealtime, we're sitting down together, we can get through it quickly because their attention span is so short. And then we're going to move on. We'll play after dinner kind of thing. But it's
Yeah.
just so important for at least 1 or 2 meals a day to try to get that family dynamic in
Yeah,
there.
absolutely. And so I've definitely heard a lot of stories of families like eating at the couch, the kids are on the floor, whatever. And
Mhm.
I'm like, no, no, we're not doing that, guys. Everybody's at the table. And it makes a big difference. And it really sets them up for success as they get older. Again, like thinking long term, how do I want my 16-year-old to be eating? I don't want them eating alone in their room. That starts today. So we're teaching 6-month-old that we're eating together at the table. They see parents interacting and talking. They see their older sibling sitting with them and interacting and talking with parents. It's just the whole vibe should be like, this is family time. This is our time to connect and talk
Mhm.
about our day. It's not me just sitting there being like, eat, take
Yeah,
another bite.
exactly. And then
So
it
like,
it should
yeah.
encourage you to be more chill about it because you're eating your dinner while they're eating their dinner, and you don't need to sit and focus on them the entire time. I know it's way easier said than done because you're concerned about them, eating and getting the food in and, not gagging and things like that. But I think the more that you can try to focus on your meal, let them do that, it will reduce the amount of times that you say, "Are you eating your broccoli? Are you eating your broccoli?" Which will, in return, lead to picky eating in the future.
And then the other part of that is letting your kid make a mess. Okay.
Mhm.
Like that
Yes.
is the aspect that's a necessary part of development. And being the neat freak that I am, I understand how uncomfortable it could make you. They're gonna throw food, they're going to get it on their hands, it goes into their hair, right? All down everything. It's part of the process. It's a necessary, beneficial part of the process. So it's not for nothing. Okay, so many benefits. You have to let them explore with all parts of their senses, like the
Yeah.
touch, the feel, the smell, everything. Okay. So don't prevent them from doing that. No, going in, it's going to be a mess,
Yeah.
calm down. But anyways, good luck learning to feed your 6-month-old for the first time or helping your toddlers continue to progress with eating. I hope you guys learned a lot today. We will keep sharing tips. So
Exactly. Follow us on Instagram at the Pediatric Dietitian. We have this podcast on Spotify. Check us out and message us with any questions. We're happy to help. We're happy to share tips and strategies and reach out if you need anything. Thank you, guys.
bye, guys.
Thank you for listening to this episode of The Pediatric Dietitian. Don't forget to subscribe and share with another parent who could use a little extra support.